Hi there. Welcome once again to the program, Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. We continue our conversations around the COVID-19 pandemic and your health. For the rest of this episode, I will take my mask off because there's no one else here next to me that can put me at risk, and I'm not putting anyone else at risk. Remember, if you have any questions or comments regarding the COVID-19 pandemic, please feel free to send us a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. So we move right into our discussions today, and we continue to have questions and comments that are coming in from viewers and listeners just like yourself. And it seems like a lot of persons are concerned about their immunity. And immunity is a specific area that needs to be looked at. What do we actually mean by immunity? How do we boost it? How do we help to augment our natural immunity? Immunity generally is our defense mechanism or defense systems against infections and other things that seek to harm us. So some of it comes naturally and is always there, and then some of it is adaptive. When you're exposed to certain issues, then your body then produces the immune response. So here's a question that actually came in from a listener or viewer just like yourself. And the question is, how can I measure my immune status? How can I measure my immune status? And is there anything we can do at home to check or boost our immunity? Important question. And we need to understand a little bit what are the body's immune system components. And it's important to know this because some things you may not consider them important parts of the body, but they're actually very, very key and critical to our immune system. And it starts with simple things like your adenoids and tonsils in the mouth. Those are important parts of our immune system. The thymus gland, which is usually behind the breastbone. The bronchus in the lungs actually has lymphoid tissue. There are lymph nodes all across the entire human body. These lymph nodes are responsible for storing and draining the lymphatic system, which is part of our immune response. The spleen, which is located in the left upper side of the abdomen, is a very important and critical component of our immune system. Of course, the bone marrow for every human being is an important part of the immune system because of what it does in generating antibodies, producing antibodies that can fight off infections. These are all important components. If we look specifically at what they do, the thymus gland, for example, is something that is involved in the formation of T cells. T cells are a type of cell that can kill infections, or it can create a memory for infections in the future. The tonsils or the adenoids are some things that distinguish invaders or pathogens or infectious sources and identifies the ones that needs to be destroyed. The spleen that we talked about, it filters blood and distributes the T and B cells. These are two different types of cells responsible for our immune system. The lymph glands or the lymph nodes are responsible for storage of white blood cell and the formation of white blood cells. The bone marrow is where the B cells are produced and therefore released into the blood to help us fight infection. All of us can remember at some point if you had a sore throat or a cough or a fever, and you may feel your neck and you can find a painful lump, something that is small like a black eyed pea. Sometimes it can be a little bit bigger, sometimes you may have more than one. That is usually your lymph node. Sometimes the lymph node behind your ear can become enlarged, swollen, or tender, and that particularly can happen when you have like an ear infection. And we've all had that at some point or the other. So we all have lymph nodes that can respond in an infection. There are two main types or two categories in which we put our immune system. One is the innate system and then the adaptive system. The innate system are things like your eyes. The production of tears actually helps to wash away potential infectious substances that come in contact with your eyes. The respiratory tract itself has a mucus lining that is protective. Those are the innate immune system. And of course, the skin is also a barrier against infection and other invading pathogens. So that's the innate immunity. Then there is the adaptive immunity. The adaptive immunity can be specific or non-specific, and these are the actual blood cells that are produced in response to infecting organisms or pathogens, whether it's bacteria, virus, parasites, etc. The non-specific ones are what we generally check if you go to hospital and the doctor orders a CBC or a complete blood count. Part of that is your white blood cells, which include different components. Then there's your red blood cells, which gives you your blood count, and then your platelets. Those are the three main things that we look for. The white blood cells, there are several types. The lymphocytes, for example, get elevated when you have mainly a viral infection. The neutrophils become elevated when you have a bacterial infection. And the eosinophils get infected, or they get elevated when you have a parasitic infection. So those are the non-specific part of the adaptive immunity. Then there is the specific part of the adaptive immunity. That involves your B cell and your T cell. Remember, the B cell is produced by the bone marrow, and the T cell is produced by the thymus gland. So let us understand a little bit, a basic concept of how these cells help to fight infection. So imagine these soldier cells circulating in the blood, okay? And then there is an infectious particle that you're exposed to, makes its way into the blood. It bypasses the skin or whatever other innate immunity you have, and it ends up in the skin. What happens is that these circulating, let's say, soldiers, these defense cells, one of the main ones is the macrophages. They identify those invading particles or organisms, then internalizes it into the cell. And once it gets into the cell, then there are enzymes and active ingredients that work on them to actually destroy them within these soldier cells. Once it's destroyed, then the cells release certain chemicals that we call cytokines that basically primes the body and warns the rest of the body that, hey, we have these invading particles and please be on the lookout for them. So hopefully that would have shed some light on our immune system, the components of the immune system and how it actually works. What can we actually do to help our immune system? So there are certain tips that are key and, basic, simple things for us to follow. The most important ones are what is in our control. is to maintain a balanced diet, which is essentially to eat lean proteins, healthy carbs, and omega-3 fatty acids. Simple hygiene practices like washing your hands. Wash with soap and water for about 40 seconds. Getting rest is very important because there are certain stress hormones that are released and controlled depending on how much rest you have, and those directly impact your immune system. Exercise has been shown and is quite well known to help boost immunity. Exercise does a lot of good things for the body, and we will talk about that a little bit later in today's episode. Hydration is also a very big part of boosting your immunity. There are very simple rules to follow, and to summarize, boosting immunity like a university course 101, that's a basic course. Sleep is critical. Your body needs sleep to fight infectious diseases, and that's because of all the hormonal balances that are in play when you are asleep versus when you're awake. Exercise is important, but it's very important to know your body, to understand how sick. If you are sick, that is probably not the best time to exercise. Exercise is actually useful to prevent getting sick, but if you happen to get sick, that's when you actually need rest more than exercise. Eating well, washing your hands, avoiding stress, and a very big one that is important as we move into the holiday season is a consumption of alcohol. It is quite well known that alcohol actually weakens your immune system. So be very responsible in the way you consume alcohol, especially during this time of the COVID-19 pandemic as we move into the holiday season. Healthy things for us to eat, or healthy tips on eating. Again, we're moving into a holiday season with Christmas, etc. We tend to eat very generously, especially in Guyana. We are very blessed to have a rich dietary culture around the Christmas time, but there are certain basic tips that we should follow. Eat when the food is hot. Microorganisms cultivate generally at room temperature. They grow more. Eat fruits rich in enzymes like papaya, pineapple, kiwi, mango, and these can actually aid in your digestion. Drink lots of water, that is self-explanatory. Drink more water than alcohol if that makes sense to you. Eat more cooked leafy vegetables like spinach and kale, or in Guyana we call it bhaji. Add ginger, garlic, black pepper when cooking. These have been shown to help boost immune systems, and maintain a healthy gut by adding probiotics in the diet. These are all very important ways in which we can use our dietary habits to boost our immune system. Foods that can actually boost our immune system naturally are, again, very regular things that we find commonly in Guyana. Tea is known to be an immune system boost. We have things like sweet potatoes, meats, barley and oats, garlic, as well as chicken soup. These are all things that are known to boost immune system, and it's important to have an adequate consumption and intake of these foods so that we can maintain a healthy immune system. In terms of our habits, as a cardiologist, it would be remiss of me for not mentioning the value of exercise. It is very critical that we maintain exercise. Moderate intensity exercise definitely improves our immune function. Immune function is greater in elderly that are conditioned versus those who are sedentary. So the elderly person who is active is much healthier than the one who is not active. Exercise reduces the risk and severity of respiratory viral infections, very important in the COVID-19 pandemic. And being moderately active reduces the likelihood of upper respiratory tract infection. So exercise is key and critical in helping our immune system and boosting our immune system to fight off infections. So I hope we would have addressed some key questions on the human immune system. And I want to thank you once again for joining me as we continue our discussions around the COVID-19 pandemic. Remember, if you have any questions or comments, feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Thank you.